Good afternoon, respected chairperson, sir, on the audience. I'm Dr. Ishita Pandey, third year PGT from Nigrum, Shillong. I'm here to present my thesis topic, that was comparison of Hill RBF3, Barrett Universal 2, Haigis and third generation intraocular lens formulas to predict the accuracy of post-cataract surgery refractive outcomes in Indian eyes. There's no conflict of interest. Introduction. Very precise preoperative biometric values are required to achieve the best post-cataract surgery refractive outcome. However, there is not a single study done to compare Hill RBF3 with the other IOL power formulas like Barrett Universal 2, Haigis and third generation formulas in Indian eyes. Such studies have been conducted in other races but not in Indian eyes till date. Material and method. Study design, we did a prospective observation study at a tertiary care center. Population, a total of 219 eyes of 173 patients that underwent uneventful phaco with PC-IOL implantation. Period was between May 1, 2021 to October 31, 2022. Instrument used was IOL Master 500 Carl Zeiss Meditech AG. Inclusion criteria was uncomplicated age-rated cataract, age being more than 40 years, and patients who underwent uneventful phaco with PC-IOL implantation and cases where optical biometry was possible were included. Exclusion criteria was corneal astigmatism more than one diopter, prior corneal refractive surgeries, prior intraocular surgeries, and pre-existing ocular diseases affecting post-op refractions were excluded. So the final post-op refraction at 1 month follow-up was expressed as spherical equivalent. The prediction error was then calculated by we did actual post-op spherical equivalent minus predicted post-op refraction, and then from there we calculated the mean and the median absolute prediction errors, and we used them to compare the post-operative predictability of each formula. We had done statistical analysis using SPSS software for Windows version 22.0, and we had measured the difference in the absolute prediction errors in post-operative refraction and comparison between the mean absolute errors of two formulas via these formulas, as we can see here, and we also calculated percentage of eyes that had predicted refractive error of within plus minus 0.25, plus minus 0.5, plus minus 0.75, plus minus 1 and more than plus minus 1 diopter target refraction. Results, the mean age was 63.66 years, total of 219 eyes of 173 patients, out of which males were 88 and females were 85, and the mean exit length was 23.17 millimeter. The pre-op BCVA in 117 eyes was more than 6 by 18, while in 102 eyes was less than 6 by 18. After the surgery, the BCVA in 216 eyes was between 6 by 6 to 6 by 9, and in 3 eyes it was between 6 by 12 to 6 by 18. We had divided our population based on exit length, as we can see here in the chart. Blue color depicts group A, which is population having exit length less than 22 millimeter. The red color depicts group B, that is population between 22 to 24.5 millimeter of exit length. And green color depicts the population, that is group C, having exit length more than 24.5 millimeter. We had implanted monofocal IOLs in 90% of the cases, while we had implanted 10% in 10% population only trifocal IOLs. So to know the accuracy of the formulas, we needed to know which formula gave the lowest mean and median absolute errors. So what we found that was for overall wide range of exit length, it was Barrett Universal 2 that gave the lowest values of absolute errors. For short exit length, as we can see here in this graph plotted, it was Hill RBF3 that gave the lowest values for the mean and median absolute errors. For normal exit length, it was Barrett Universal 2 that gave the lowest values, and for long exit length, it was SRKT that gave the lowest values of absolute errors. We also got to know that Barrett Universal 2 had the largest percentage of eyes within plus minus 0.25, plus minus 0.75 and plus minus 1 diopter of target refraction. However, Hill RBF3 had the largest percentage of eyes, that is 88.1% within plus minus 0.5 diopter of target refraction. Discussion. This is the first study to compare the post-phaco emulsification refractive results using Hill RBF3 with Barrett Universal 2, Haigis and third generation formulas in Indian eyes. Many studies have found that Barrett Universal 2 stands as the most accurate formula over a wide range of exit length. Study by Sellar et al. Was the only study done so far where Hill RBF3 was compared with the other formulas. What we found in our study was Barrett Universal 2 was the most accurate IOL power formula over a wide range of exit length in Indian eyes, followed by Hill RBF3. HIL-RBF3 and SRKT were found to be most accurate IOL power formulas for short and long axil lengths respectively. Limitation was that astigmatism more than one diameter cylinder were not taken into consideration, and a smaller number of population were present in the short and long axil length groups. Conclusion. So in our study we found that BUII Universal 2 was the most accurate IOL power formula over a wide range of axil length in Indian eyes, and it was also the most accurate formula for predicting errors within plus minus 0.25, plus minus 0.75 and plus minus 1 diopter of target refraction. However, HIL-RBF3 was the most accurate formula for predicting errors within plus minus 0.5 diopter of target refraction. HIL-RBF3 and SRKT were found to be most accurate for short and long axil lengths respectively. It is hoped that the outcome of this study will help the surgeons to choose the best IOL powers for their patients by utilizing the best IOL power calculation formulas, thereby helping the patients to get the best refractive outcomes. Thank you.
Thank you, Ishita. Actually, in spite of all efforts, many times we land up in surprises.
Yes.
We wish that there were just one single formula which would have covered all the grades and cataracts. So thank you very much.
I think there's a software with the artificial intelligence this thing.
Yes, sir.
Which integrates all the formulas and then gives you a single formula for either short, medium and long.
Yes.
Okay, sir.
So instead of going for selecting for long and short eyes, just have a